So the sickle cell disease is a disorder of the hemoglobin, and the hemoglobin is a protein present in the red blood cells, carries the oxygen. So what happens in the sickle cell disease, the hemoglobin is defective. Because of that, the shape of the red blood cells, instead of having a flexible discoid, it becomes a rigid and a sickle shape like this. So like this shape, and because of this shape, the red blood cells are unable to move freely in the our blood circulations, leading to the decreased blood supplies to those critical organs, as well as the early destruction of those red blood cells, ending in the anemia. How do we get the sickle cell disease? It's a genetic disorders, means we inherited these disorders from one of our for both of our parents who do harbor the defective sickle cell gene, and so it's autosomal recessive in inheritance, which means that both the copies of the gene has to be defective to get the manifestation of this sickle cell disease. And the sickle cell disease has the various symptoms in form of anemia, low hemoglobin that leads to the weakness, tiredness, fatigability. The another important troubles what patients has in the daily life is the pain. They do have a lot of pain, bony pain, unable to work much, that fatigue and the tired. So that's a constant problems in some of the patients. Sometimes they do get the severe pain, that what we say the pain crisis, that sudden onset of the pain, maybe especially the chest pain. So pain crisis is an issue. They can have the infection, they are more prone for the infections. So the anemia, bony pain, pain crisis. They can have the aplastic crisis, mean there is sudden drop in the hemoglobin level, and that ended up in the ICU and the need for the blood transfusions. Another complication which can happen, especially in the kids, is the sequestration crisis, meaning the sudden enlargement of the spleen, and that leads to the accumulation of the lot of blood in the spleen, lead to the fall in the hemoglobin in the blood circulation. So you can have the pain crisis, you can have the sequestration crisis, we can have the aplastic crisis. Patients can have the stroke, that's another complication. Patients can have a stroke at the younger age. They can have the renal impairment, they can have the hepatic impairment because of the decreased blood supplies for a longer period of time if we don't correct this sickle cell disease defect. Yeah, we do have some good news that with the simple measures, right, we can diagnose this sickle cell disease, and this is with the blood test. So there are the blood tests. We can do the electrophoresis testing on the blood, simple test. If we want to go with the genetic testing to prevent this disease in the further our kids and the further pregnancies, we can do the genetic testing. So it can be diagnosed and it can be detected. If it is diagnosed and it can be detected, if it's there, we now need to prevent for the going forward to the further generations. Yeah, so we do have another good news for our patients who has been diagnosed with the sickle cell disease, that it can be cured with the therapies which we say medically the bone marrow transplant, where we do change the defective factory making the sickle cell proteins, sickle cell hemoglobin, sickle cell red blood cells, and we exchange with the healthy donors red blood cells. So bone marrow transplant is one of the curative therapy. There are certain measures apart from the bone marrow transplant which need to be taken. We have certain medications which can minimize those symptoms, and for that important aspect is to follow up with a clinical hematologist on the regular basis. Talk to your pediatricians who is pediatricians or the physicians that need to consult a hematologist. I think they'll guide you to which is the hematologist close by. So the unfortunate situation happens when the patients develop the severe complications, right, like that stroke. So they are highly prone for the stroke. They are highly prone for the other end organ damage like nephropathy, hepatopathy. They have the ischemia, the avascular necrosis of the bones, which means they are unable to walk, and there is a severe pain on the joints, and sometimes ended up in the replacement of those joints, hip joints specifically. So end organ damage and the complications. The sickle cell disease, as I mentioned, we can diagnose. There are certain features patients present with that one, and which sometimes, if not treated, can end up in the complications. Now, how to prevent those complications is general measures. Let's have a general measures which has an important impact on the quality of life. So, keeping ourselves hydrated, avoid the dehydrations, taking the regular medications like folic acids, hydroxyurea, and regular follow-up for the end organ assessment, and then you need for a specialist consultations with the hematologist. So that's the measures. I would like to put one stress on the hydroxyurea. A lot of families, they think that hydroxyurea is being used for the cancer patients. Sometimes they read on the Google that hydroxyurea can cause the cancers also. I think these all are myths, yes, but we use the hydroxyurea in cancer patients also, but the dose what we use in sickle cell disease is much lesser than the cancer patients, and the hydroxyurea has been used for the almost 4-5 decades, and none of the patient who has the sickle cell disease received the hydroxyurea has evolved to the cancer. So it's quite safe medicines, and the benefits are overwhelming. So I endorse to not to discontinue these medications with the fear. And if you are still doubt, yeah, please do come and rediscuss with your clinical hematologist. So finally, I would like to conclude that despite the lot of advancement in the managing the sickle cell disease, including the bone marrow transplant, the patients do come at the very late stage for a hematologist consultation. So I would request for the viewers who are having this sickle cell disease or who are relatives who have the sickle cell disease, please do guide them to the hematologist. And another good news, we do have some gene therapy evolving in the sickle cell disease has been approved. It's a little costlier for our Indian continents, but yeah, so that we are moving positively for those gene therapies. So keep following with your hematologist. So to check on your end organ, to check on your health, for need for any additional support in case it's required, and then finally need to go with the bone marrow transplant in any time point we can go with that.